one quick revision for the very important topics, especially the image based session. Okay, so first of all the best for the tomorrow session, for the tomorrow exams. Don't worry, okay, be happy. तो जितना कूल रहेगा, जितना रिलैक्स रहेगा, जितना अच्छे तरीके से खुद को कंट्रोल कर पाएगा, वो अच्छा परफॉर्म करेगा. और याद रखिए, जो हुआ अच्छा हुआ, जो हो रहा है वो अच्छा हो रहा है, और जो होगा वो बहुत अच्छा होगा. आपने जैसा पढ़ा, जितना पढ़ा, जितनी भी तैयारी की, रिमेंबर ऑलवेज दैट यू डिड इन अ वेरी बेस्ट वे. आपके सर्कमस्टांसेस थे, फैमिली के प्रॉब्लम्स थे, आपके खुद के इश्यूज थे, कॉलेज के इश्यू थे, दोस्तों के प्रॉब्लम थे, इनके बीच में आपने जो सबसे बेस्ट टाइम आप जो निकाल सकते थे उसको करते हुए आपने पढ़ा. तो हमेशा जब आप एग्जाम हॉल में जा रहे हैं तो एक चीज याद रखिए, यू हैव टू बी कॉन्फिडेंट दैट यू डिड वेरी बेस्ट एंटायर ईयर. अब आप जो भी करेंगे फोकस करते हुए बहुत अच्छे तरीके से. आंसर आपके सामने में है. यस, 4 ऑप्शंस आर देयर. आपको उनमें से सही आंसर को ऑप्ट करना है. वेरी गुड फैक्ट फॉर द एमसीक्यू एग्जाम्स दैट आंसर्स आर इन फ्रंट ऑफ यू. तो जो जितना कूल रहेगा, जितना रिलैक्स रहेगा, महेंद्र सिंह धोनी की तरह, ओके, घबराना नहीं है. ओके, तो ओनली यू हैव टू ऑप्ट द करेक्ट आंसर. डेफिनेटली यू विल गो इन योर selection pathway. So can we start? Okay, fine. So we are going to start our session. Quick revision, mainly the image based session. So anatomy questions. On the basis of the analysis, I am putting here the images. One question from the general anatomy, sure. Last year there was the one question. Can you tell me the answer? Quick. Question from the December FMG 2021. Frontal plane section is termed as, yes, sagittal section, and then coronal section, then horizontal section, and the oblique section. What is your answer? Yes, frontal section, which divides the body into the front and the back. Yes, this is our coronal section. तो एक क्वेश्चन इस पैटर्न से आने के चांसेस हैं. Can you see the anatomical position? The body is erect. Okay, sir. You can see the eyes looking forward. You can see hands hanging by the side. You can see palm directed forward. You can see toes are together and forward. This is our, remember, it is our anatomical position. Correct, you all are correct. Now see the plane which is dividing the body into the 2 equal half, right and left, that is mid sagittal plane. Yes, Arsh, you are correct, beta. Now see the frontal plane, the plane which is dividing the body into the front and the back. So the any plane which is dividing the body into the front and the back, that is a coronal, also known as a frontal, and the plane which is parallel to the ground, that is a horizontal plane. Okay, why this knowledge is important? See here, our this session is integrated anatomy. हम सिर्फ anatomy cover नहीं करेंगे. On the basis of the anatomy, we will go for the radiology, we will go for the orthopedics, we will go for the our medicine, surgery, ENT, ophthalmology, all the other session. Okay, so we must know the sagittal plane, frontal plane, coronal plane, horizontal plane, because it will be useful for the radiology understanding. Getting the point? So now come to the next one question. I am telling you from the joint. Yes, one question is going to be asked from the joint topic. Why one question is going to be asked from the joint topic? See here, can you tell me the answer? December FMG 2021, there was the one question from the radiology image, and they put, yes, 3-dimensional orientation. In exam, any kind of the question may be asked. Getting the point? Yes. Cadaveric image, any image from the atlas, any image from the any kind of the textbook, linear diagram. Yes, this is the one 3-dimensional view which will help you to crack cadaveric images, which will help you to crack any kind of the atlas image. Yes, this is our pelvic bone. You can see there is a right hip bone and the left hip bone. Both are having the in between them there is the our cartilage plate. Can you tell me? Yes, it is which type of the joint? See here, you can guess the question. This question had been asked in 2021, and the same question had been asked in FMG 2020. Getting the point? Same question. यहां पर बेटा ऑस्टियोलॉजी दिया, और जबकि यहां पर क्या दिया? रेडियोलॉजी. So this is the radiology integration with the anatomy. Yes, it is our secondary cartilaginous joint. How can you guess? Any fibrous kind of the joint you are looking, there is a fibrous disc, but it is having the cartilage also, which is located at the midline. Yes sir, it is located at the midline. तो इसको आप secondary cartilaginous joint कहेंगे. Yes, one quick revision, classification of the joint. There are the 3 types of the joint. Suppose this is the bone, correct sir? if these are connected together with the fibrous connective tissue, one question surely from the our joint, then it is fibrous joint. Now suppose these are the two bones, getting the point, and if these are interconnected together with the help of the cartilage plate, then it is known as cartilaginous joint. And if suppose these are the two bones which are interconnected with together, yes, with the help of the fibrous connective tissue, and inside it there is the synovial fluid, yes, इसके चारों ओर आपको एक फाइब्रस कैप्सूल नजर आ रही है और इसके अंदर साइनोवियल फ्लूइड भरा हुआ है. सो दिस इज द साइनोवियल जॉइंट. Getting the point? So this are the three types of the joint. Can you see what are the three types of the joint? Again, revise with me. Chanting करो बेटा मेरे साथ. Yes, fibrous joint, cartilaginous joint, and third one is the synovial joint. Getting the point? Now try to understand what are the different types of the fibrous joint. You can remember the mnemonic sa su ji. Yes. शादी के बाद ससुर जी और सासू जी. सो हियर इज अ सासू जी. S for sutures, S for syndesmosis, G for gomphosis. Sutures are present in the skull bone. Yes sir. Sutures are present in our skull bone. So when you observe the different skull bones, yes, you will see the sutures. Can you observe the sutures? Yes. So these all are the sutures. They are the too much many other types. You can go for our detailed videos, but right now tomorrow is the our exam, so we are not going to for that. Yes Shivani, your trick is Sasuji, SSG. S for sutures, S for syndesmosis, and G for gomphosis. Never forget the G for gomphosis, which is present in the gums, S for suture, which is found in the skull, and syndesmosis, it is found at the inferior tibiofibular joint. Now see the cartilaginous joint, primary cartilaginous and secondary cartilaginous. Remember this secondary cartilaginous is very important. It is found at the SIM. Yes, S for symphysis pubis, I for intervertebral disc, and M for manubrium turni. These all are the joint which are present at the midline. Getting the point? So this is your secondary cartilaginous joint. Yes, primary cartilaginous joint, it is present in between the epiphysis and the diaphysis. Hope everybody, yes, Shivani, Arsh, Ashia, you all are getting the point. Yes, if you all are getting the point, just give me the thumbs up. Just give me the thumbs up. Okay, see here, this is the rapid revision. We are going to cover all the important things in 1 hour. Okay, so you have to focus करो, enjoy करो. यही चीज कल आपको एग्जाम सेशन में करनी है. You have to find out the best answer among the 4 option. और अगर आप फोकस करेंगे तो आपकी जो भी पढ़ी हुई चीज है उन चीजों से आंसर आपको मिलेगा. ओके, यस, सिम इज योर आंसर. यस रमेश. सो नाउ वी आर गोइंग टू मूव फॉर द synovial joint, ball and socket joint. It will be useful for the orthopedics also. That is our shoulder joint, that is our hip joint. Yes, our saddle joint, the best joint, that is the our first metacarpo. Yes, first metacarpocarpal joint. Okay, so carpo-metacarpal joint first at the base of the thumb. Yes, condylar joint. The classical example is our bicondylar joint, that is the knee joint. Ellipsoid joint. Yes, ई को याद रखना, ई को धक्का देना, डब्ल्यू बन जाता है, डब्ल्यू से होता है रिस्ट. रिस्ट जॉइंट इज द एग्जांपल ऑफ द इलिप्सॉइड जॉइंट. हिंज जॉइंट, यू ऑल आर अवेयर, आवर एल्बो जॉइंट इज द hinge joint. Don't forget this pivot joint, the C1 C2 atlantoaxial joint where the no movement occurs, that is pivot joint. And the plane joint, the intercarpal joint. Okay, our ribs and vertebra, they are joining together with the plane joint. Okay, hope you all are getting the point. So one question I told you that is going to be asked from the general anatomy, one question definitely from the joint. हो सकता है joint से question ना है, लेकिन आप मेरे को बताइए क्या बिना joint पढ़े आप ऑर्थो में एक भी कदम रख सकते हैं? नो, नेवर. रिमेंबर दिस अवर पोर्शन ऑफ द जॉइंट इज वेरी इंपॉर्टेंट. गेटिंग द पॉइंट? ओके, तो जॉइंट से एक क्वेश्चन जरूर आ रहा है, आइदर मे बी आस्क्ड फ्रॉम द एनाटॉमी और फ्रॉम द ऑर्थो. ओके, सो जस्ट सी हियर व्हाट आर द डिफरेंट बोन्स in our upper limb. Yes, there is our clavicle, then there is our scapula, and then there is a humerus. So you can see this all the bones. Clavicle is also known as the beauty bone. I am showing you the three-dimensional anatomy. Yes, one quick review. Can you see? This is the our key bone, collarbone, clavicle. This is the our beauty bone, MCQ. Then you can see this is the our scapula. This is also known as the shoulder blade. Then you can see this is the funny bone, MCQ. This is the funny bone, humerus. What are the important nerves related to the humerus? That is very important. Surgical neck of the humerus is related with the axillary nerve. Yes, surgical neck of the humerus is related with the axillary nerve. Then in the radial groove there is the radial nerve. Behind the medial epicondyle you will find out there is the ulnar nerve. And remember, from supracondylar area there will be the median nerve. So four nerve relation, very important for the anatomy as well as orthopedics. Now see here, after this you all are aware, at the lateral side you will get there is the radius. Yes, and then on the medial side you will get there is the ulna. Okay, and then there are the carpal bone. You all are aware, there is the sequence. She looks too pretty. Scaphoid, lunate, triquetral, pisiform. Then trapezium, trapezoid, capitate, hamate. Getting the point? Pisiform is the example of, yes, write down in comment box ये pisiform bone जो है इसे हम कौन सा bone कहते हैं. This is the one very important MCQ. And then you can see the metacarpal and the phalangeal bones. Now after this quick revision, come to here. What are the our different important hybrid muscles? तो जब हमारी फेस टू फेस क्लासेस चल रही थी तो हमने एक फनी निमोनिक बताया था. दिस इज वेरी इंपॉर्टेंट क्वेश्चन, द हाइब्रिड मसल्स. यस, रिमेंबर BSP. ओके, बहुजन समाज पार्टी कौन ज्वाइन किया? Ufa ji is joining the Bahujan Samaj Party. You can remember. Yes, so SR medical videos given the correct answer, that is a Susmod. Yes, Shivani, you are right. The sequences, she looks too pretty, try to catch her. Okay, so what are the hybrid muscle? What is a hybrid muscle? Any muscle which is having the double nerve supply is known as the hybrid muscle. So brachialis, do you remember Mr. Brachialis? M for musculocutaneous nerve, R for radial nerve. So these are the two nerves of the brachialis. As well as subscapularis is supplied by upper subscapular, lower subscapularis. That's why it is our, remember, hybrid muscle. Pectoralis major and pectoralis minor both are supplied by the lateral pectoral nerve and the medial pectoral nerve. So this is your, yes, remember, it is our hybrid muscle. Yes, Bala, I can show the nerve course, but we do that in our detailed classes. This is the short 1 hour class, so in 1 hour we have to cover all the things. So hope you are understanding, otherwise you can go for the detailed videos, but tomorrow is the exam. So right now we are concising the anatomy in 1 hour. Okay, so flexor digitorum profundus, see here, flexor digitorum profundus, it is supplied by median nerve lateral half, while the medial half is supplied by the ulnar nerve. Flexor pollicis brevis, it is supplied by the median nerve and ulnar nerve both. Superficial head, median nerve, deep head, ulnar nerve. So remember, these are the our hybrid muscle. Hybrid muscle is very important topic. Okay, now see here, can you tell me the answer? This is the question pattern, image based question pattern. Can you tell me what is the situation? Which muscle is paralyzed? So comment in the chat box. And this is that particular muscle. This is the one having the muscle. This muscle is having the tooth-like appearance. So this is the serratus. It is going to the entry side. That's why anterior. It is supplied by one nerve which is running in the thorax with the long course. Because this nerve is running with the long course, that's why it is long thoracic nerve. Also known as, this is also known as Bell's nerve. Yes, this is our muscle which is getting paralyzed. Yes, you all are correct, Steretus Anterior. And this situation is known as pinging of what? Scapula. Remember, this muscle is also known as, because when this muscle will contract, it will cause forward movement of the scapula, protraction. It will cause this pushing and punching action. That's why this muscle is also known as boxer's muscle. So remember, to be very important for your orthopedics as well as for your anatomy. And then you have to go for the brachial plexus. Definitely one question is going to ask from the brachial plexus. You can follow here the brachial plexus, which is supplying the brachial, means you can say upper arm. Plexus means bunch of the nerve. Okay, so the bunch of the nerve which is supplying the upper limb, that is your brachial plexus. Getting the point? Yes, you all are correct. Yes, SR medical, you are right, but boxer's muscles and Bell's nerve you have to remember. So you can see the C5, C6 roots are coming, then C7, C8, T1 are coming. C5, C6 they are uniting and making the upper trunk, then C8, T1 they are uniting and making the lower trunk, while the C7 is independent. Now each one is dividing into the division, entry division, posterior division, entry division, posterior division. Behind this our bone, that is the clavicle, and here is the bunch of the nerve, that is our brachial plexus. You can see all the posterior divisions are uniting together. Yes, all the posterior divisions are uniting together and they are making the our posteriorly running cord, which is continuing as the radial nerve. Okay, so you have to know about the our all the branches of the Yes, brachial plexus. We had seen in our detailed classes that there are the roots, trunk, division, and the cords. Roots, they were giving the dorsal scapular nerve. Very important question. It had been asked. Root value is the C5, and it is supplying the levator scapulae, rhomboid major, and rhomboid minor. Okay, so this is the one important question. Long thoracic nerve, MCQ. It is supplying which muscle? It is supplying the boxer's muscle. And also the phrenic nerve is participating in the brachial plexus. Root value of the phrenic nerve, very, very important. 3, 4, 5 keeps diaphragm alive. What you have to remember? Yes, phrenic nerve root value C3, C4, C5. 3, 4, 5 keeps diaphragm alive. And then you have to remember the branches from the trunk. In FMG 2019, one question had been asked. Remember, only the upper trunk is giving the branch. That is your, yes, supraescapular nerve and subclavius nerve. Yes, Shivani, you are correct, beta. Our mnemonic was the Raju Taylor drinks cold beer. Yes, perfect. Yes, so now we are going to look for the division. Division is never giving the branch. And the cords, you all are aware. Do you remember how we were remembering the lateral cord, the posterior cord, and the medial cord? Lateral cord, mnemonic was the LML, lateral pectoral nerve, musculocutaneous nerve, and the lateral root of the median nerve. All we are having the branches, root value C5, C6, C7. Posterior cord, what was the mnemonic? That was the ultra. U for upper subscapular nerve, L for lower subscapular nerve, T for thoracodorsal, R for radial nerve, and A for axillary nerve. Okay, all we are having the root value C5, C6, C7. Okay, and the medial cord, M for you. Do you remember? We remember the trick. M for you, मैं तुम्हारे लिए तुम हमारे लिए. Okay, मैं हूं ना. M for you. Yes, M for medial pectoral nerve, M for medial cutaneous of the arm, M for medial cutaneous of the forearm, and then M for medial root of the median nerve. And last U was the ulnar nerve. So go for this, our brachial plexus. It is very important. And the clinical point that is very, very important. Brachial plexus C5, C6, C7, C8, T1. These are coming from the our neck portion. So if there is the injury to the neck part, there is the os palsy. It is causing damage to the our C5, C6. So there is damage to the upper trunk. While if there is a damage to the axilla here, so C5, C6, C7, C8, T1. Do you remember C8, T1 lesion? That is leading to the damage to the lower trunk. There is the ulnar nerve damage. This was the Klumpke's paralysis. So here we did our surgery and ops-gynae integration. Yes, do you remember? Correct, Arsh? Remember the phrenic nerve is C3, C4, C5. 3, 4, 5 keeps the diaphragm alive. Now see shoulder dystocia. When there is a delivery of the baby, you are pulling the head. आपने सिर को जोर से खींचा. In that situation, there is a damage to the nerves in between the head and shoulder. कोई अगर मान लो हेड और शोल्डर के बीच में चोट खाता है, in that situation, there is the damage to the our, yes, between head and shoulder, upper trunk. So it is leading to the os palsy. So this is the situation of the os palsy. Yes, Abha Silvert, quick revision of the dermatome. You can go at my channel today at 6 PM. There is a premium for the dermatome. अभी भी हम इस dermatome को discuss करेंगे, but there is a one concept behind the dermatome which you can get at the 6 PM. And remember, this dermatome is very important for the our medicine, surgery, as well as ortho. So you will get one question definitely tomorrow from the dermatome topic. Okay, see here, this is the our position. Can you tell me what is the name of this situation? This is known as the our policeman tip hand. ऐसा लग रहा है जैसे कि इसको पैसे दो तो ये सीधे जेब में रख लें. तो policemen, they are taking the tip. वो रिश्वत ले रहे हैं. So in case of the damage to this our upper trunk, there is the adduction, medial rotation, extension of the elbow, and there is the pronated hand. This is known as our, yes, Abha. Hope you will enjoy the dermatome session also right now. Okay, so this is our policeman or veteran tip hand. Can you see this point is known as no excuse? This is the our os palsy where the 1, 2, 3, 4, 5, 6 nerves are meeting together. Okay, so remember this point. Now can you see the Klumpke's paralysis? If there is the axillary injury, so there is a lower trunk lesion. In that situation, you will see the ulnar claw hand. This is our Klumpke's paralysis. It is associated with the our what? Remember, that is the Horner's syndrome. Ophthalmology integration, the ptosis, meiosis, anhidrosis, anophthalmosis, along with the loss of ciliospinal reflex is known as our Horner's syndrome. So remember one question from here, either from the anatomy or from the your orthopedics. Now see here, yes. From the upper limb, what I told you, one question from the general anatomy, sure. One question from the joint portion is very, very high probability. And in upper limb, what you have to read the clinical situation, nerve lesions. Okay, so this is our question. Leprosy treatment is the clue. Okay, and then in image you can see there is a ulnar claw hand. So which nerve is damaged? Write down in your answer box. Yes, write down. Yes, arch is correct beta. Ulnar nerve. Correct. Ulnar nerve. Okay, so this is the your question pattern. So get ready. Can you see this another question from our FMG 2020? Yes, they asked that there is the damage, there was the fracture at the shaft of the radius. Okay, yes, 35-year-old male, fracture at the arrow, inability to extend the wrist, no extension of the wrist. So wrist was having the drop situation, that is our wrist drop. Getting the point? So wrist drop due to the radial nerve. If there is a fracture to the our shaft of the humerus, radial nerve damage. Can you see there is a lateral aspect of the hand and fingers, sensation are lost. So lateral side में sensation गया, that is a dermatome. So this is again indicating the lateral part of the hand. It is supplied by our, remember, that is leading to the our, yes, radial nerve. It is due to the radial nerve injury. Okay, now see here, this is very important, dermatome portion. Can you see the dermatome of the hand? So you can observe here, this is the palmar surface. In the palmar surface, lateral 3.5 supplied by the medial nerve. No excuse. Very important. And then medial half 1.5 is supplied by the ulnar nerve. And at the base of the thumb, you will see the radial nerve. Okay. हमने जब अपनी थ्योरी क्लासेस की थी तो वहां पर 3 भाइयों की कहानी सुनी थी जो इसके लिए था. आप बिल्कुल नहीं भूल सकते इनको. वो बहुत ही फनी सी, बहुत इंटरेस्टिंग कहानी है. But when you are looking the dorsum of the hand, can you see the lateral 2.5 is supplied by the radial nerve. The medial 2.5 is supplied by the ulnar nerve. Except the base of the lateral 3.5, they are supplied by the median nerve. So these are our points. Okay, yes, first wave space, but here no meaning of the first wave space. In our lower limb we will see that first wave space in our lower limb is supplied by the deep peroneal nerve. वहां पर हम देखेंगे. Fine. Now come to our clinical. Can you tell me what are this situation? Can you tell me what is the situation? Yes, this is the special kind of the position of the hand shown by the Christian community Pope. Okay, तो आप देखेंगे संत, yes, Pope, Father, they are giving the blessing in this way. In Hindu culture, tathastu, but in Christian community, the position of the hand, can you see this one is the position? This is known as Pope hand deformity. MCQ, Pope hand, also known as Benedict hand deformity. Getting the point? Then focus here over the hand. Which nerve injury? Yes, answer is your median nerve injury. Can you tell me this is what is the name of this test? Yes, correct Umar, correct Arsh, you are correct beta. Now try to understand. Yes, this is what kind of the nerve is injured here. Yes, this is known as pointing index. Yes, it is found in the median nerve injury. Can you tell me what is the name of this test? Yes, this is the Ochsner clasp test. Yes, it is the Ochsner clasp test. ऐसे ही इमेज आएंगे ऑर्थो के, एनॉट के, सर्जरी के. दिमाग में बैठा लो, रट लो इनको. बिल्कुल गलती नहीं करनी, बहुत ज्यादा पढ़ने का कोई मतलब नहीं. जस्ट यू हैव टू रिवाइज द प्रीवियस थिंग्स. Yes, this is the Ochsner clasp test. This is again median nerve injury. And can you tell me what is the name of this test? कोई भी इमेज आया और उसमें पेन दिखा दिया, अंगूठे से ऊपर टच करने के लिए बोल रहा है, आंख बंद करना बोल देना, पेन टेस्ट. This is the pain test. Yes sir, this is the pain test. Which nerve injury? Yes, remember it is again seen in the median nerve injury. Yes, can you see this type of the image? ऐसा अगर कोई इमेज आए एग्जाम में और आप देख रहे हो अंगूठे के पास वाला पार्ट जो चपटा है, yes, thumb portion is flat. This is our app thumb deformity. Yes sir, this is our app thumb deformity. Getting the point? Again answer is median nerve injury. Getting the point? Yes, tell me which nerve course is here? एक नर्व आ रही है और ये lateral 3.5 को सप्लाई कर रही है. आंख बंद कर दो, सीधा बोलो, this is the median nerve. Yes, adrenaline, you are right beta. Yes, Shivani, you are right. Meningococcus, you are right beta. Or you all are perfect. Very nice answers boy, you all the guys. बेटा ये क्वेश्चन एनॉट में आएगा, ये क्वेश्चन आपके ऑर्थोपेडिक्स में आएगा. Can you see? This is the condition. You are cutting the flexor reticula. Why? Because the median nerve is getting compression below the flexor reticula. This is known as carpal tunnel syndrome. Carpal tunnel syndrome is due to median nerve injury. Getting the point? Yes, Shivani, you are correct beta. Yes, so this is the carpal tunnel. Can you tell me this is the which sign? Written it is written tinel sign. जब क्लास चल रही थी तो मैंने बताया था tapping, टिनल टिनल टिनल। ओके यस, डू यू रिमेंबर? हमने साथ में ये भी देखा था, फॉल फॉल फॉल, फैलन फैलन फैलन। These are the test for the carpal tunnel syndrome. Never forget for the your orthopedics surgery and the anatomy. Yes, this is the integrated anatomy session in 1 hour. Okay, so these all are the signs for the median nerve. Last में बेटा याद करो, हमने अपने थ्योरी क्लास में देखा था what are the different clinical points for the median nerve। तो median nerve के clinical केसेस के लिए हमने एक निमोनिक याद किया था, क्या? कैप्टन अमेरिका कैप, कैप्टन अमेरिका कैप। यस, कैप्टन अमेरिका is not the MBBS student, he is the bachelor in physiotherapy, BPT. You can remember this funny mnemonic, BPT cap or cap BPT. So what are the signs for the median nerve? B for Benedict hand, yes sir, B for Benedict hand और Pope hand deformity. Yes, कल बेटा क्वेश्चन डायरेक्टली यहीं से आपको देखने के लिए मिलेंगे। P for pointing index, P for yes pointing index, it is also known as the Oshner class test, लगभग एक जैसी चीजें हैं। Yes, T for Tinel sign, again found in the median nerve injury. Yes, C for carpal tunnel syndrome, C for carpal tunnel syndrome, then A for act thumb deformity, P for phalanx test and P for pen test। खुद पर भरोसा करो बेटा, खुद पर भरोसा करो। आपने जितना पढ़ा है, जो पढ़ा है, कम पढ़ा है, ज्यादा पढ़ा है, जैसा भी पढ़ा है, बट कीप कॉन्फिडेंस। कुछ भी हो, कल एग्जाम में मैं तो बना के आऊंगा, मैं तो मार्क करके आऊंगा। आपको फोकस करना है। द्रोणाचार्य ने अर्जुन से पूछा क्या दिख रहा है, अर्जुन का सिर्फ एक जवाब था, चिड़िया की आंख। यू हैव टू फोकस फॉर दैट ड्यूरेशन ऑफ द योर एग्जाम। अपनी थॉट्स को इधर ना जाने दो, उधर ना जाने दो, फोकस करो क्या क्वेश्चन पूछा है। कोई जरूरी नहीं कि वो क्वेश्चन आपने पढ़ा ही है, एग्जैक्ट सेम क्वेश्चन है, ये कैसा भी आ सकता है, बट यू हैव टू फोकस एंड ट्राई टू रिकॉल व्हाट एवर द फैक्ट्स यू हैड स्टडीड। और जो भी चीज आपने पढ़ी है, चाहे कम पढ़ी है, ज्यादा पढ़ी, उनके बेसिस में जो बेस्ट आंसर लग रहा है वो ऑप्ट करने की कोशिश करो। और यस, याद रखना, खुद पर कॉन्फिडेंस रखो बेटा। आपने जैसा भी पढ़ा है बहुत अच्छा किया है। ओके, सो नाउ वी आर यस। तो अर्श गौतम इज आस्किंग महाराज एक शायरी, तो आपके लिए एक शायरी हो जाए। अर्ज किया है, बोलो यहां पर यस। तो हम सोच रहे हैं कि भाई आपने कहा यस, इरशाद इरशाद इरशाद। माहौल बनता जब फेस टू फेस क्लासेस होती है। शायरी सुना रहा हूं, जरा गौर से सुनना। शायरी सुना रहा हूं, जरा गौर से सुनना। मुझे शायरी नहीं आती, किसी और से सुनना। ओके, सो जस्ट वन फनी वे सो दैट यू कैन मोर कॉन्सेंट्रेट विद द लाफिंग, विद द स्ट्रेस फ्री लेफ्ट मूड। ओके, एक और अर्ज करते हैं भाई आप लोगों के लिए, तो बोलिए इरशाद। यस, उमर इज हियर। यस, तो हम आपके लिए एक और अर्ज करते हैं। दरकत के पैमाने पे चिलमने हुस्न का फुरकत से यूं शर्माना। तो यहां पर उमर साहब की हमको वाह भी मिल गई। दरकत के पैमाने पे चिलमने हुस्न का फुरकत से यूं शर्माना। पहली लाइन समझ में आए हो तो हमको भी समझाना। Okay, so just one funny way so that you can enjoy. Yes, Dr. Vladimir Putin is also giving irshad. So thank you very much for all of you. तो आगे फिर से हम बढ़ते हैं अपने कोर्स की तरफ। Yes, see here we had seen the median nerve, the Tinel sign, phalanx signs, they are very very important. Yes, give your smiley, give your buck up thumbs up and enjoy this session. You will also do very well tomorrow. Relax रहो, cool रहो, calm रहो, focus करो बेटा। Okay, so come to here. Yes, you know our KK साहब, हम दिल दे चुके सनम, वन सॉन्ग इज देयर, फोरेंसिक मेडिसिन इंटीग्रेशन। यस, फोरेंसिक मेडिसिन इंटीग्रेशन। के साहब ने एक गाना गाया और उसको हम एनाटॉमी के साथ इंटीग्रेट करते हैं। इन्होंने गाना गाया ऐश्वर्या राय के लिए, सलमान खान के लिए, हम दिल दे चुके सनम मूवी में। ऐश्वर्या राय, शी वॉज कटिंग द रिस्ट जॉइंट, so there is the tentative mass. Yes, forensic medicine. Yes beta, good afternoon. So there is a forensic medicine, tentative mass are found in case of the wrist cut injury. तो जब wrist cut होती है तो क्या क्या चीजें मिलती हैं, क्या क्या चीजें कटती हैं? The structures which are passing above the flexor reticula, they will cut, but median nerve is not crossing. Median nerve is below the flexor reticula, so it will not cut. तो के साहब ने एक गाना गाया, कौन सा गाना गाया? तड़प तड़प के इस दिल से आह निकलती रही, हमको सजा दी प्यार की, ऐसा क्या गुनाह किया तो लुट गए, हाँ लुट गए। के साहब को याद करते हुए, फोरेंसिक मेडिसिन को इंटीग्रेट करते हुए, ऐश्वर्या राय, व्हेन शी विल कट द रिस्ट जॉइंट, टेंटेटिव मार्क्स विल बी फाउंड, बट रिमेंबर मीडियन नर्व विल नेवर कट। यस, इट इज अ बिग लॉस. Our KK Sahab is not with us, but we will always remember him. Okay, yes. Now see here, why with this image, again recall, this is our palmar aponeurosis. So when there is the fibrosis of the palmar aponeurosis, you will get the dupuytren's contracture. Rheumatoid arthritis is associated with the dupuytren's contracture in your medicine. See here, tomorrow connective tissue disorder, vasculitis, sure one question will be asked, among which the rheumatoid arthritis is important. In chronic alcoholic, in connective tissue disorder, in rheumatoid arthritis, this dupuytren's contracture is found where you will see there is the fibrosis of the our palmar aponeurosis. Getting the point? Yes. Hope you all are enjoying. Yes. Now see here, we are going to talk about our ulnar nerve. What are our important ulnar nerve signs? See here, can you tell me what is the name of this test? Yes, tell me. ये बेटा कार्ड रखा हुआ है. This is the card test, very important. Yes, you can see there is the our card is placed in between the thumb. So this is the Froment sign. It is again for the ulnar nerve. You will see this is the our complete claw hand in case of the median nerve and ulnar nerve both injury. Yes, so these are the our different things. This is the our Igawa test. Igawa test is again for the our ulnar nerve. How can you remember? Yes, during the theory class I told you ulnar nerve test. We are not using the U, we are using the ALNER. Yes, it is very old mnemonic. Remember, what are the different tests for the ulnar nerve? You can remember the A, B, C, D, E, F. ABCDEF आता है ना, बिल्कुल आता है सर, वही तो याद करना है. कल ये आपके एग्जाम में आने के बहुत ज्यादा चांसेस है. इट इज वेरी इंपॉर्टेंट नॉट ओनली फॉर द एनाटॉमी बट फॉर योर मेडिसिन, फॉर योर सर्जरी एंड फॉर योर ऑर्थो. यस, ulnar nerve, it is giving the ulnar nerve injury, book test positive. C for card test positive. Yes, D for adductor polycystic test positive. E for Igawa test positive. F for Froment sign positive. So these all the tests are found positive, and this is very important image based question. Yes, very most important for tomorrow. This is the short intrinsic muscles of the hand. Can you see there is a tendon, flexor digitorum profundus. Can you see the unilateral unipinnate muscle? This is the first lumbrical. Yes, this is the second lumbrical. These are unipinnate. Yes sir, these are unipinnate, but third and fourth, these are bipinnate. These are the bipinnate lumbrical muscle. Getting the point? This first and second lumbrical supplied by which nerve? Median nerve, and this bipinnate muscle, medial 2, are supplied by the ulnar nerve. So these are the very important point. Never forget, it is very important question. कल बेटा यहाँ से क्वेश्चन आने के बहुत ज्यादा चांस है. Yes, these lumbricals are helpful for this our pain holding position. It is responsible for the pain holding position. Also you can remember Baba ji ka ठुल्लू position, our Kapil Sharma show. You can remember the Kapil Sharma show. So right now try to understand lumbricals are doing this activity. So agar yes, first and second lumbrical supplied by the your median nerve, third and fourth supplied by the ulnar nerve. So if both the nerves are proper, then all the lumbricals are proper. So this is the your position. Flexion at the metacarpophalangeal joint and extension at the interphalangeal joint. This is activity of the lumbricals. But if median nerve and ulnar nerve both are damaged, then at site of the flexion there will be the extension, at side of the extension there will be the flexion. So this is your complete claw hand. Don't forget, it is very important. Yes, Arsh, deltoid is bipinnate. No, middle fiber of the deltoid is multipinnate. Deltoid is multipinnate and only middle fiber. Remember, this is also one important question. So this is the our complete claw hand found in median nerve and ulnar nerve both injury, because all the lumbricals has gone. But if there is the normal median nerve, ulnar nerve is only affected, then only the medial 2 lumbricals will be affected. Why? Because this medial 2 lumbricals are supplied by the ulnar nerve. So ulnar nerve damage, these are paralyzed, so only the partial claw hand will be found. Getting the point? Now see here, these are the palmar introtiae. These are unipinnate. When this will contract, they will cause midline movement. Yes, these are the our unipinnate muscle, palmar introtiae. Palmar introtiae are adductor. Palmar introtiae are adductor. So mnemonic was the PAD pad. Palmar introtiae are adductor, while the dorsal introtiae, you can see these are the bipinnate. When they will contract, they will cause away from the movement, away from the midline, that is the abduction. Getting the point? So dorsal introtiae, they are abductor, DAB, you can remember. Getting the point? Both introtiae supplied by the ulnar nerve. Remember, all the introtiae, palmar introtiae or dorsal introtiae, they all are supplied by the ulnar nerve, and for them we are performing this different test which we have already discussed. Now yes, this is the Igawa test, which is the test for the DAB. Dorsal introtiae are abductor. Dorsal introtiae, they are causing abduction, while this card test is the test for the pad. Yes, it is a test for the ulnar nerve. Yes, it is a test for the our ulnar nerve. So these are the our direct questions which are going to be asked tomorrow. Getting the point? Now try to understand. This is the our Again, section of the carpal point. Can you see? She looks too pretty. Scaphoid, lunate, triquetral, pisiform. Try to catch her. Trapezium, trapezoid, capitate, hamate. Yes, these all are making one tunnel like structure. एक सुरंग जैसा structure बन रहा है. And one another. Yes, you can see here one fibrous modification is above. This is our flexor reticula. Getting the point? All the important structures are passing below it. Can you observe here that median nerve is passing below to this flexor reticula, but ulnar nerve and ulnar artery they are passing above the flexor reticula. इसलिए जब के साहब गाना गाते हैं उस समय हम दिल दे चुके सनम मूवी में जब ऐश्वर्या राय अपने रिस्ट को काटती है तो ये 5 सुपरफिशियल स्ट्रक्चर कटेंगे, बट मीडियन नर्व इट विल नेवर कट. This is your forensic medicine integration. And remember, ulnar nerve, ulnar artery, these are passing through the Guyon's tunnel. Yes, this is new question pattern. This is our Guyon's tunnel. So if there is a compression of this Guyon's tunnel, there is the ulnar nerve and ulnar artery will getting damaged. This is very important fact for the tomorrow's exam. Yes, this is the Guyon's tunnel. So this Guyon's tunnel is commonly compressed in the cycler, जो cyclist होते हैं उनमें. So this is also known as our, yes, remember, it is our handlebar palsy syndrome. This is the Guyon's tunnel compression, that is the Guyon's tunnel syndrome, also known as our handlebar palsy syndrome. Getting the point? So these are our different things which you have to remember. Now come to the radial nerve. If there is a radial nerve injury, this all the things are found. Can you tell me what is the name of this sign? Yes, can you tell me what is the name of this sign? Can you tell me what is the name of this sign? What is the name of this syndrome? And what is this new condition? Yes, this all are our new question pattern. Radial nerve is getting injury in axilla, that is known as crutch palsy. MCQ. Orthopedics also. This is Saturday night and the person is drinking and sleeping over the chair. So this is your, yes, Saturday night palsy. This is no excuse wrist drop, radial nerve injury. Yes, this is your finger drop. And this is new question. This is our honeymoon palsy, radial nerve injury. Okay, this is honeymoon palsy. Okay, so these are the different signs related to our radial nerve. So these questions are going to be asked. Now we are going to talk about our, yes, lower limb portion. So you can see in the lower limb there is our hip bone, the strongest and longest bone of the body, that is a femur. Yes, largest seed like bone, that is our patella, and our preaxial bone tibia. Lateral bone is the fibula, and then we will talk about our foot bone. Yes, gluteus maximus, medius, minimus, these are important muscles. I am showing you these important few muscles. Yes, here one important muscle is the sartorius. This sartorius is also known as the Taylor's muscle. It is also known as the honeymoon muscle. Remember this question? Yes, can you see this largest muscle of the body? This is the gluteus maximus. It is important. Yes, it is coming from the our hip bone, sacrum and the coccyx area and getting insertion into the iliotibial tract as well as our gluteal tuberosity. It is supplied by the, remember, it is not supplied by the superior gluteal nerve, but it is supplied by the inferior gluteal nerve. Correct. Getting the point? So this is important. Now see here, when you are cutting this muscle, then you will see in your cadaveric image, this is your gluteus medius, and then you will find there is the gluteus minimus. Got the point? Now after this all, you will get one pear-shaped muscle, that is the piriformis, and after this piriformis, one muscle is coming from the inner side of the obturator foramen, that is the obturator internus. Okay, so these are the important points which you have to remember. Yes, one question frequently asked, that is the gluteus medius and minimus. These are responsible for the proper abduction of the hip joint. These are supplied by the superior gluteal nerve. Okay, so these are the important questions. Now see here, this is the image based session. Again, you can see this is our hip bone, our sacrum and the coccyx. So gluteus maximus is located here. We had cut and removed. This is our gluteus medius, then you will see gluteus minimus. Remember this gluteus medius minimus, here we give the intramuscular injection. Then you can see there is our piriformis muscle, and then you can see obturator internus with superior gemelli and inferior gemelli. You can see the thickest nerve of the body, that is the sciatic nerve, which is related with the sciatica and the sleeping foot. So these are the important your questions and the image based study. Now try to understand, this is your inversion and eversion movement. Okay, so one question from this part, inversion and eversion. Fine, you have to remember the movement of the foot. Ankle joint, there is our flexion and the extension. Flexion is done by the all posterior compartment muscle, extension is done by the all anterior compartment muscle. Getting the point? And yes, Dr. Memon, sure beta, I will share this PDF. Already one rapid revision session is also there. You can get at my Telegram channel. I will share to the Sermon Institute also, from where you can get it. Okay, so now see here, there is a subtalar joint. You can see there is an inversion and eversion. No excuse. Inversion is done by the tibialis anterior and the tibialis posterior, and eversion is done by the peroneus longa and the peroneus brevis. Directly question will be asked here. Okay, also you have to remember Uttar Pradesh long question. U for unlocking. No excuse. Unlocking is done by the popliteus and locking is done by quadriceps femoris. So no excuse with this our Uttar Pradesh long question and inversion eversion movement which occurs at the subtalar joint. Okay, so remember this all the points. Now see here, foot bones. Yes, there was the radiological image and navicular bone was asked. So try to understand. I'm showing you the identification of the bone. It is very important because of the clinical. Remember, you will see the clinical point due to the arches of foot. It is related with the arches of foot. Can you see MCQ? Largest bone of the foot, calcaneum. Above the calcaneum, whatever the bone is visible, that is the talus. Just in front of the talus, can you see there is the navicular bone? Yes, just in front of the navicular, can you see 1, 2, 3? Three our cuneiforms, medial cuneiform, yes, intermediate cuneiform and lateral cuneiform. Can you see first, second and third metatarsal bone, and laterally you can see the cuboid bone. Here you can see the fourth and fifth metatarsal, and these are the our phalanges. So remember, this is related with the our arches of foot deformity, congenital talipes equinovarus, this all the situation. That's why the identification of the foot bone is important. Okay, so these are the important points related to the our point. Now definitely one question from the palpable artery of the body. See here, what are the different palpable arteries of the body? Yes, superficial temporal artery. Yes, now see here, here is our axillary artery, here is a brachial artery in the cubital fossa, then you can palpate the radial artery in the wrist joint. Getting the point? Yes, most common injured foot arch. See here, medial arch, medial longitudinal arch, that is the very strong arch. Lateral longitudinal arch is comparatively less strong, so you will see in the orthopedics. Okay, so lateral longitudinal arch, it is weak arch comparatively. Now see here, what are the other palpable artery? In thin people you can palpate the abdominal aorta, in thin people only. Then femoral artery you can palpate the, yes, your popliteal artery in the popliteal fossa. Then you can palpate the anteritibial artery, posterior artery, and also the dorsalis pedis artery. So remember which artery is palpable here. This is the artery which is palpable behind the our, yes, medial malleus. So this is our posterior tibial artery. This is very important question. And one more artery which had been asked again and again, that is the middle meningeal artery. So remember this all the things. See here, can you see, this is the our common iliac artery. Yes, it is dividing into the internal and external, yes, three-dimensional orientation. So this external iliac artery is continuing as the femoral artery. This artery is reaching into the our femur part. Yes, this is the femoral artery. Vascular sign of Narath, your orthopedics integration. Now this femoral artery is running in our popliteal fossa behind the knee joint. So this is our popliteal artery, and then you can see this artery is dividing into the our anterior tibial artery, because this artery is running in front of the tibia. Can you see? Yes. And one another branch which had been asked frequently, hat-trick times, posterior tibial artery, it is running just behind the, can you see, this is your medial malleolus, just behind the medial malleolus. This is the posterior tibial artery. Can you see here? Yes, there is the our anteritibial artery which is continuing as the dorsalis pedis artery. Very important surgery integration, that in case of the Berger disease, thromboangiitis obliterans, these arteries are blocked. That's why the palpable arteries of the lower limb, very important. Get ready, one artery sure tomorrow. So what I want to tell you, tomorrow one question from the general anatomy, one question from the joint topic, one question from the upper limb. most probably the nose of the upper limb integrating with the ortho, integrating with the radiology. They will show the x-ray of the upper limb fracture. Okay, and from the lower limb, either the our bones or any muscle like the gluteus maximus medius, and yes, they will give any palpable artery of the body. Right now, lower limb palpable artery, they are important, but remember, middle meningeal artery was running in your pattern just few years back. So these two arteries, posterior tibial artery and middle meningeal artery, that is the current pattern. Okay, now see here, this is the same artery. I will provide this PDF, you can go for it. Okay, so all the arteries and their site of the palpation, that is described. Okay, now we are going to talk about the head neck area. So in the head neck area, they are giving the cadaveric image. So first of all, you must remember what are the 8 branches of the external carotid artery. Go at my Insta channel, there are the reels, 30 seconds. Yes, you can catch there the 8 branches of the external carotid artery. Yes, external carotid artery, it is giving the first branch to the our pharynx. Remember, the first branch of the external carotid artery is ascending pharyngeal artery, not the superior thyroid artery, according to the Grace 42nd edition, according to the Cunningham textbook, according to the ENT textbook, according to the surgeons. Remember, superior thyroid artery is not the first branch, not the first branch, not the first branch. Don't do mistake. Which is the first branch? Ascending pharyngeal artery is the first branch. Okay, and remember, it is the only medial branch. This is the very, very important question. Then it is giving the blood supply to the thyroid, superior thyroid artery. It is giving the tongue, lingual artery. It is giving the artery to the face, main artery of the face, facial artery, which is also known as the anesthetist artery. Getting the point? And then it is giving the branch towards the occipital region, occipital artery. It is giving the branch to behind the ear, posterior auricular artery. It is running in the temporal region, superficial temporal artery. It is giving the branch over the maxilla, maxillary artery. And remember, this is our carotid sheath. Okay, so in the carotid sheath, you can see the common carotid artery, which is dividing into the internal carotid and external carotid artery. Yes, you can see outside there is one vein, internal jugular vein, and the nerve, that is the vagus. So these are the content except the external carotid artery. But when you are cutting, also you will see the 9th, 11th, 12th as the content at the upper part. This is the Gray's Anatomy update. So remember, so content are, remember, the 9th, 10th, 11th, 12th. And when you are making the cross section, you will observe one loop of the nerve on the entry wall. So this is the question, anterior wall. AN for anterior, A for ansa cervicalis. There is one loop of the nerve. When you will cut, only the 2 dots will be seen, and on the posterior side you will see sympathetic trunk. In between the our common carotid artery and internal jugular vein, you will see the 10th cranial nerve also. Getting the point, everybody? Okay, so now this is our venous drainage. You can go for this. Only one thing you have to remember, this lower part of the nose and upper lip, it is the dangerous area of the face because it carries the infection to the cavernous sinus, which is carrying the venous blood, which is related with the different cranial nerves as well as internal carotid artery. So death can occur. Now, after this all, see here, this is the question from the head neck area. Can you tell me what is the answer? They had shown this image and they asked about the, it is epiglottis, vocal cord, genioglossus or esophagus. So here is the image. Just I am doing integration. कभी भी बेटा कैडेवरिक इमेज आए तो पहली चीज घबराना नहीं, आसपास की कोई सिली चीज को लेना. यस सर, दिस इज द नोज एंड द माउथ. ओके सर, यहीं से शुरू करते हैं. तो अगर ये चीजें आपको समझ में आई तो आपको लगेगा ये एंटीरियर है, दिस इज द पोस्टीरियर साइड. ओके सर, नाउ सी हियर, दिस इज आवर स्कल. फाइन, मैंने आपको बताया था स्कल के नीचे फिर बेटा आपको ब्रेन की टिश्यू मिल रहा है. फाइन, मैंने आपको बताया था एक सीक्वेंस CSF. yes, C for, can you remember, this is the corpus callosum. S for septum pellucidum and F for fornix. बिल्कुल यहां से क्वेश्चन आपके आते हैं. CSF. Then I told you the our arbor vitae. Arbor vitae is located here. This is our cerebellum, लिटिल ब्रेन. नाना पाटेकर बोलता है पीछे नहीं मारना चाहिए क्योंकि पीछे छोटा दिमाग होता है. यस, आभा यू आर राइट, रिड्स यू आर राइट, शिवानी यू ऑल आर राइट. Epiglottis. Yes, Shivani, I think you are the student from our face-to-face classes. That's why you are giving the correct answer. Okay, बेटा. तो face-to-face classes में हम ये सारी चीज डिस्कस कर चुके हैं. Yes, remember, cerebellum is known as the little brain. नाना पाटेकर कहता है कि यहाँ पीछे नहीं मारना चाहिए. Okay, क्योंकि छोटा दिमाग होता है. Which is the little brain? Cerebellum. This is the question. Can you see? 1, 2, 3. Our mnemonic is M PM. Yes, this is the medulla, here is the pons, and this is the midbrain. Getting the point? These are our different structures. आगे हम बढ़ते हैं. I told you this is the V के आगे O के आगे T, तो ये आपका ट्रिक बनता है VOT, वोट. यस, वही चीज जो नेता हमसे मांगते हैं, वोट आपको याद रखना है. व्हाट इज दिस V फॉर यस वर्टिब्रा, O फॉर यस रिमेंबर इट इज ईसोफेगस, T फॉर यस ट्रैकिया. अगर इतनी चीजें समझ में आ जाए तो यस आप याद रख सकते हैं. यस यस पूजन करेक्ट बेटा, यस शिवानी करेक्ट. नाउ सी हियर, अगर इतनी चीजें समझ में आ जाए तो मैंने आपको क्लास में बताया था द अपर पार्ट ऑफ दिस अवर esophagus is known as pharynx. So this is the entire portion our pharynx, and you can observe there is the location of the our trachea. So the upper part of the trachea, this is our larynx. तो larynx के ऊपर जो स्ट्रक्चर आपको नजर आ रहा है, larynx के ऊपर, yes the laryngeal cavity is known as the glottis. तो larynx के ऊपर जो आपको नजर आएगा that is the epiglottis. So the question had been asked about the epiglottis. What you have to remember? The esophagus upper part is pharynx. Yes, upper part of the trachea, that is your larynx. Simple. Esophagus के ऊपर होता है pharynx. Okay sir. Upper part of the esophagus, pharynx. Trachea के ऊपर होता है larynx. Yes, upper part of the trachea, that is the larynx. Simple word. Okay, and you can see this is our nasal cavity. So behind the nasal cavity, nasopharynx. This is our oral cavity. So behind the oral cavity, you will get the oropharynx, and this is the larynx. So this will be the laryngopharynx. Got the point? Yes, this is our cricopharyngeal junction, which is the narrowest part of the GIT C6. You have to remember. तो कई सारे MCQ यहां से बनते हैं. Yes, C6 कई सारे MCQ बनते हैं. See here, pharynx is ending at which level? C6. One MCQ. Esophagus is starting at which level? Answer is C6. Another MCQ. Next MCQ. Larynx is ending at which level? C6. Another question. Trachea is starting at which level? C6. Next question, cricopharyngeal junction is situated at which level? Yes, C6. Narrowest point of the GIT? C6. All answer C6. So hope you are catching the point. This is very important. Entire things we had done. Now integrating with the radiology and cadaveric image. Just apply that all the things again. See here. E, S, F. Yes. बेटा कॉर्पस ये बहुत इंपॉर्टेंट है. कॉर्पस कलोजम, सेप्टम पेलोसोडम, फॉर्निक्स. कल आपका यहां से क्वेश्चन जरूर आ रहा है. Sorry. Getting the point? Fine. You can see this is the cerebellum. I told you MPM, medulla, pons, midbrain. Getting the point? And one more thing you have to remember. This is our T, H, and last is P. THP. T for थैलेमस. थैलेमस के नीचे क्या मिलेगा? हाइपोथैलेमस. और हाइपोथैलेमस, yes, it is controlling the pituitary gland. So this is our pituitary gland. Yes, this is your pituitary gland. Okay, that is a pituitary stalk gland is removed during the our dissection. Now compare with the radiology. See here, this is the radiology. Again, you can see, yes, this is our skull bone. Fine. Then you can see the brain. Can you see the CSF? Same things. Radiology बेटा तभी आसान होगी जब आपका anatomy strong होगा. Yes. C, then S, then F. That is the corpus callosum, septum pellucidum, and the fornix. This is your yes cerebellum. You can see the M, P, M, medulla, pons, and midbrain. And I told you here is the T, then H, and then this is P. THP, thalamus, hypothalamus, pituitary gland. Khatam. Okay, so go and recall whatever we studied. हमने पूरी एक क्लास लगाई थी न्यूरोएनाटॉमी की बहुत अच्छे तरीके से. नॉट ओनली द न्यूरोएनाटॉमी, इंटीग्रेटिंग विद आवर अदर सब्जेक्ट्स. ओके, सो दीज आर द आवर डिफरेंट थिंग्स. नाउ कम टू दिस आवर डर्माटोम. Yes, today at 6 p.m. at Dr. Shrikant Verma classes YouTube channel, there will be one video live premiere where you can see all the dermatome. But right now, what you have to remember, angle of mandible, it is supplied by the great auricular nerve. That is the word C2 MCQ. I told you in the theory class, C1 no dermatome, C1 no dermatome, C2 angle of mandible, then C3, C4, C5. आपको हाथ रखना C3, C4, C5 supraclavicular area. So this is C3, C4, C5. The same root value phrenic nerve. Then I told you the C5 is coming here, and this is C6. Thumb is supplied to the C6, and then there are the different kind of the changes. Here the middle finger C7, and this is the C8. So C6, C7, C8. But if not possible, there are the many varieties. So C6, C7, C8 is also right. And then there is a T1, and here is the T2. Ulnar board of the forearm T1, ulnar board of the arm T2, and this T2 is going to the our intercostal space also. So this T2 is also known as the intercostal brachial nerve. Yes, remember nipple is supplied by the T4 and umbilicus is supplied by the T10. No excuse. This inguinal region is having the L1, very very important, ilioinguinal nerve. And then you can see the L2, L3, L4. This L4 is reaching to the our great toe L4. So this was the question from the FMG 2020. Yes, identify the dermatome of the our great toe L4. And then these are our L5, and no excuse with this S1. S1 is our sural nerve. And remember the first wave space. Okay, the first wave space is supplied by the deep peroneal nerve. Very important. Remember, at the neck of the fibula there is a common peroneal nerve. If it is damaged, then there is the foot drop. These all are the important questions. Getting the point? Okay. So now we are going to look for this all the things. Then you have to turn the person S1, S2 at this ankle area behind S1, S2. Getting the point? So at this lower part behind the ankle joint, you will get the S1, S2 portion. Fine. This is root value of the ankle jerk also. I told you in the class. Yes, there is a 1, 2, 3, 4, 5, 6, 7, 8. This was the mnemonic. 1, 2. आपको हाथ को कहाँ पर रखना है? Ankle joint में. 1, 2. Then 3, 4. Yes, knee jerk. Then 5, 6. Then 7, 8. 5, 6 biceps jerk, and 7, 8 that is our triceps jerk. So these are our different points. Now see here. This is the cranial cavity. Cranial nerve and the different structures in the cranial cavity. Remember, the first cranial nerve is coming from here. This is our first cranial nerve. Cranial nerve, so very important topic. Then through the optic canal, can you see the second cranial nerve, optic nerve is passing. And here you can see the location of the pituitary gland. On each side of the pituitary gland, cavernous sinus. Can you see? When you are removing the cavernous sinus, you can see the third cranial nerve. You can see the thinnest cranial nerve, fourth cranial nerve, then fifth cranial nerve, which is dividing into the V1, V2, V3. Yes, our V1 is passing through our superior ophthalmic fissure. Yes, it is passing through our superior orbital fissure. V2 is passing through the foramen rotundum, and V3 is passing through the foramen ovale. So I told you, किंग जो होता है वो सेंटर में बैठा रहता है, इसके दोनों तरफ क्वींस होती है, दैट इज अ फोरामेन लेशरम. एंड देन on each side there was the our different foramen. You can remember the R, O and SE, rose, king queen rose. R for, I told you, that is the rotundum foramen. O for oval foramen. S for spinosum foramen. Okay, so there is the our foramen spinosum. Getting the point? So these are the your different things. Rotundum इससे V2 पास होता है, foramen oval इससे male पास होता है, no excuse. M for, yes, that is a mandibular nerve. A for accessory meningeal artery. L for lesser petrosal nerve. E for emissary vein, no excuse. Foramen spinosum इससे बेटा M, E, N पास होता है. Remember, M for middle meningeal artery. Mama, very 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 important question, many time asked. E for, yes, emissary vein, sometime passing, sometime not. N for nervous spinosum. Can you see? This is our one artery which is coming from the foramen spinosum and then passing outside the dura mater. This is nothing, it is the middle meningeal artery. Very very important question. Middle meningeal artery, very many time asked question. Getting the point? Okay, Shivani, okay, Abha, yes, Dr. Vladimir, hope you all are getting the point. If you are getting the point, just give me the thumbs up. Okay, hope you are getting the point. Yes, just give me the clapping if you all are concentrating. Focus, focus, focus. It is very important. Middle meningeal artery. Yes, it is passing outside the dura mater. So no excuse. Its damage causes the extradural hemorrhage. Hope in medicine, in surgery you had seen extradural hemorrhage. You have to make the neurosurgery. Drilling operation over the pterion. Per opening you have to do. Getting the point? And you have to remove the clot. Yes, thank you everybody, thank you. So you have to remove the clot. Okay, extradural hemorrhage is very very important. Now see, after this you can see the sixth cranial nerve. This is your internal acoustic meters from where 7th, 8th cranial nerves are passing. and then you can see our jugular foramen from where 9th, 10th and 11th cranial nerves are passing. Getting the point? And then you can see there is a presence of the S-shaped sinus, sigmoid sinus, and the last one, can you see? This is your last cranial nerve, 12th cranial nerve. So these are the important structures which you have to remember. Now try to understand. This is the cavernous sinus, very important topic. This is our cavernous sinus, pituitary gland. On each side there is a cavernous sinus. Hope in different subject, ENT and medicine, you had seen. Lateral wall is having the third, then fourth, then V1 and then V2, and V3 is outside. Remember, according to the new Gray's anatomy, now the V1 is also passing outside. So V2 is also shifted, and the content is our internal carotid artery and our abducenter nerve. This abducenter nerve is passing through the one canal that is known as the Dorellos canal. So these are our important question. Okay, yes, Omar, you are right, that is a mamma, middle meningeal artery. So this is our situation of the pterion, which is H-shaped area. Inside it there is the middle meningeal artery, mamma. If it is getting rupture, it will cause, yes, lens shaped convexity on the temporal side. This is by convex lens shaped opacity. Definitely it is your case of the extradural hemorrhage. For the extradural hemorrhage, for the, yes, it is due to the mamma rupture. No excuse, it is very important. Subarachnoid hemorrhage due to the our berry aneurysm rupture. No excuse with this all the point. Now see here, spinal cord question had been asked that it is ending at which level in the newborn. So remember, in adult it is ending at L1 is the best answer. Otherwise L1 L2 junction also you can mark, but in newborn, yes, answer is L3. So you will do the lumbar puncture below to it at our L3 L4 junction, lumbar puncture. So this is the site of the lumbar puncture. It is the same level of the our iliac crest. Getting the point? Now try to understand. This is the section of the spinal cord. You can see the central canal, gray matter, and these are the white matter, where the different tracts are located, which you study in your physiology portion. Fine. Now see here, this is the our, yes, superolateral surface of the brain. I told you in the classes that there is our central sulcus. In front of the sulcus there is the our motor area. Behind to it there is a sensory area. What you have to remember, the maximum asked question, this 44-45, which is the Broca's area, while this area number 22, the posterior part of the our, yes, audito-psychic area, that is our Wernicke's area. Remember this point. Okay, and this is our homunculus representation. Remember, this is the coronal section of the brain. This is superolateral surface which is supplied by the middle cerebral artery. This is the medial surface of the brain which is supplied by the anterior cerebral artery, and this is the inferior surface of the brain which is supplied by posterior cerebral artery. So remember, if in medicine you are getting the case, there is a blockage of the middle cerebral artery, there is a paralysis of the upper limb and the our face, which will be lost. If there is the blockage of the anterior cerebral artery, the perineum region and the lower limb portion, it will get paralysis. Posterior cerebral artery, it is supplying the occipital area, so there will be the problem in the visual function. Getting the point? Now try to understand the blood supply of the brain. The brain is supplied by our vertebral artery as well as our, yes, internal carotid artery. They are making one circular anastomosis. Can you see? This is the circular anastomosis which is known as circle of Willis. We had seen the circle of Willis in our theory class. Just recall one. Yes, see here, image based. The two vertebral arteries are coming together and meeting together, making the basilar artery, because it is running in the base of the our, yes, brain. Now it is dividing the posterior cerebral artery. Here is the internal carotid artery which is giving the anterior cerebral artery, posterior communicating artery, and middle cerebral artery. Yes, two anterior cerebral artery, they are communicating with the anterior communicating artery. So in this way, 5 components of the circle of Willis, yes, anterior communicating artery, anterior cerebral artery, internal carotid artery, posterior communicating artery, and posterior cerebral artery. Circle of Willis is very important, and this is our diagrammatic presentation for the different structures. When you are cutting, yes, you will see the, again, C for corpus callosum, then thin septa, that is the septum pallidum, and then you will get the fornix, CSF. This is our midline structure of the brain. That is our third ventricle. On each side of the third ventricle, there is a thalamus. Above the thalamus, you will see the caudate nucleus, and just lateral to it, you will see the boomerang-shaped structure. That is our internal capsule. Then lateral to it, yes, lateral to it, you will get one lens-shaped nucleus. That is a lentiform nucleus. And then you will see the ECI, E for external capsule, C for claustrum, and I for insula. And compare this all the structure in the radiology portion. Yes, if you are having knowledge about our section of the brain anatomy, you can easily crack the radiology portion. Now try to understand the abdomen. Only one thing you have to focus for the abdomen, that is the anteroabdominal wall. Yes, compare with the body anteroabdominal wall of the heroes, you will get the different layers. There is the skin, superficial fascia, deep fascia is absent, then muscle which is outside, that is the external oblique, then muscle is the internal oblique, then transverse abdominis. You are looking the, yes, six-pack ab muscle, that is a rectus abdominis. Remember one question from the anteroabdominal wall. Yes, in patient presented with the hernia. So this hernia topic of the surgery is related with the inguinal hernia. Yes, anteroabdominal wall. Deep inguinal ring is situated in which part? Answer is the fascia transversalis. Inguinal hernia topic is related with our anteroabdominal wall. When you are having the knowledge of this anteroabdominal muscle, then you can crack it. Neurovascular bundle in abdomen, it is running in between what? Answer is second and third layer of the muscle, means internal oblique and transverse abdominis. So you have to know that 8 layers, you have to know these muscles. Okay, so one topic from here. Now see here, esophagus. Hope in ENT you had studied the esophagus, so I'm not talking about it, but this esophagus, sure, tomorrow one question. Okay, what are the constriction of the esophagus? That is very important. Okay, now see here, there are the few important relation. Yes, stomach is there, then there is a first part of the duodenum, second part of the duodenum, third part, and so on. Remember, first part of the duodenum is located at the L1, second part L2, third part L3. So these are the important relation. Yes, head of the pancreas is within the our C loop of the duodenum, and the body and the tail, can you see, tail is situated in the our spleen hilum. Okay, and remember, just above this first part of the duodenum, you will see there is the our foramen of Winslow, which is located at the T12 level. Yes, so these are the important point. Total length of the duodenum is the 10 inch. You can remember D1, D2, D3, D4, D1 at the L1, D2 at the L2, D3 at the L3. So 2 inches, 3 inches, 4 inches, and 1 inch. Total 10 inch is the length. What are the different structures having the 25 centimeter length? We had seen the mnemonic DUTS. Okay, duodenum, ureter, descending colon, esophagus, and stomach. These are the 5 structures. Okay, so these are the points. Also the portal vein. Portal vein is formed at the level of the L2. It is formed by the splenic vein. Can you see? Yes, sir, splenic vein and our supramesenteric vein. These are meeting together behind the neck of the pancreas at the level of L2. Okay, so this is our important point. In thorax, one thing you have to remember, that is a coronary artery circulation. When you are cutting, you are looking the external intercostal, then internal intercostal, then innermost intercostalis, and you are looking the relation VAN, van relation at the costal groove. Getting the point? So this is important point. Yes, never do thoracocentesis here. You will do damage to this van. First intercostal space, it is not having the van relation. This was the question previously asked. Okay, always do the thoracocentesis where you have to perform at the lower border of the our intercostal space. Now see here, this is our tracheal bifurcation. One question had been asked about this, that trachealis muscle, when you will cut this trachea, so there is a C-shaped, and posteriorly the muscle will be the trachealis. So remember this point. Also you can see the lung. Lung is having the upper lobe, middle lobe, lower lobe in the right side, while the upper lobe and lower lobe only on the left side. Only one fissure, oblique fissure, but right side oblique fissure as well as horizontal fissure. Here is our heart, so cardiac notch and lingula is present. Okay, now see here, heart. Coronary circulation is very important. When you are removing the pericardium, you can see 2 layers, fibrous pericardium and serous pericardium. Serous pericardium is having the parietal and the visceral layer. In between them there is a pericardial fluid. Now see here, this is the image based session. You will see that aorta is coming out. So this is the artery which is running on the right side, right coronary artery, and the artery which is coming from the left side, that is simply our left coronary artery. But this left coronary artery is immediately dividing into the, yes, anterior interventricular artery, which is also known as the widow's artery. MCQ. This is also known as the widow's artery, and this is the your diagonal, like running artery, diagonal artery, and this is the circumflex artery. Getting the point? So this is our circumflex artery, and this is the diagonal artery. One artery is running at the margin, that is your marginal artery. This is our apex of the heart, which is supplied by our anterior interventricular artery. In medicine, you say this is the LADA, left anterior descending artery. Now, after this all, yes, these are the few questions. This is the image you can practice. Okay, the largest vein of the heart, coronary sinus, it is located on the back side. Okay, now come to the important points of the embryology. Embryo and the histo, they are not too much output area, but just one description, one our points which earlier we had seen. See here, neural tube related question. I told you that there is a neural plate, then it is making the neural groove, then it is making the neural tube. It is having the anterior neuropore, it is having the posterior neuropore. Remember, anterior neuropore closes at the 25th day, while the posterior neuropore closes at the 28th day. And folic acid is very important. Yes, vitamin chapter, biochemistry, very important. Folic acid is very important. If folic acid is deficient, then neural tube defect occurs. If the cranial portion is open, then it is anencephaly. So answer is the anterior neuropore defect. This was the question. Answer was the anterior neuropore defect. Very important. Okay, it is due to the folic acid deficiency or the anti-epileptic drug. It causes the neural tube defect. Okay, now see here, there was the question in newborn baby, meconium was coming from the umbilicus. Meconium means fecal material. Yes sir, it was our fecal material. So it is patency of the vitelo-intestinal duct. Okay, remember, vitelo-intestinal duct is attached to our GIT. Remnant of the vitelo-intestinal duct is also known as the Meckel's diverticula. Another question from the embryology session, can you see umbilicus again? Okay, during examination newborn baby in the nursery, contrast dye is introduced in the bladder to the urethra, and radiologically dye was passing to the umbilicus. Most likely anomaly. Answer is Urical Fistula. Yes, can you see? This is our bladder portion. Dye was introduced and it is coming from the our umbilicus. Can you see this situation? We know from the surgery, any abnormal opening, two opening, that is fistula. One opening, that is sinus. And no opening is there, then it is known as cyst. Got the point? Yes. So in this situation, this is our answer, Urical Fistula. Now histology, one question had been asked that which of the following epithelium is seen, that is our fallopian tube. Yes, we all know this is our female genital tract. Secretion is required, so columnar epithelium is important, and it is having the function to move the sperm. So remember, this is your cilia. Okay, yes Shivani, I will share better, don't worry. Yes, so ciliated and no multiple layer, so simple ciliated columnar you have to say. Fine, so answer is A. Also, one image was given, identify the Mardi structure. Different follicles are given from your physiology, Opsganian and not integration. If one cavity is seen, then you will say the antral follicle. If multiple cavity will be seen, then pre-antral. So you can see here, multiple cavity, pre-antral. If one cavity, antral. Okay, so this is your point. Now one question in histology from the cartilage. Don't watch the histology, embryology. Only the few points you have to focus. In histology, only the epithelium and the cartilage. Yes, whenever you are looking the bluish discoloration, that is a hyalo appearance, hyaline cartilage. Getting the point? Chondrocytes are visible. You can see the nucleus, lacuna and variable group. If bluish appearance, then hyaline cartilage, which is found in your mnemonic is girlfriend, car, growth plate, fetal cartilage, costal cartilage, articular cartilage and respiratory tube. Yes, one thing if you want to remember, don't forget this articular cartilage, which is having the hyaline cartilage. This point is very important. Next, if you are looking any cartilage, chondrocytes are visible and single double fibers are seen, then remember it is elastin cartilage. What is your trick? Yes, 3E. What are these 3E? You can see there is the ear pinna, eustachian tube and epiglottis. 3E you have to remember, elastin cartilage. Yes Shivani, GF car we remembered in our face-to-face classes. T for yes, ETC, mnemonic is the ETC news. T for yes, tip of the nose. tip of the arytenoid cartilage, and tritiate cartilage. So these are the mnemonic. C for yes, cornuate and cuneiform cartilage. These are elastic cartilage. And last, fibrocartilage. This is found in the Fiat logo. So whenever you are looking the chondrocyte and outside the our fibrous connective tissue is found, then it is our collagen bundle. This is our fibrocartilage. Okay. So where these are found, the fibrocartilage, it is very strong cartilage. Yes, F for fibrocartilage, I for intervertebral disc, the part of the body where too much strength is required, there is the presence of fibrocartilage. Yes, A for articular disc, menisci of the knee joint, even the temporomandibular joint, they are having the our articular disc fibrocartilage. Okay. Yes, elastic cartilage never calcify. You are right, Umar. Okay, then tendon insertion, it is also very strong, and labrum, glenoid labrum and acetabulum labrum. Remember one more thing, many types of the cartilage are there, type 1, type 2 and type 4. They are important. Type 1 collagen, it is found in the BAL, in ball type 1. No, not this ball. Okay, B for bone is having the type 1 cartilage. A for yes, remember aponeurosis means flat tendon, they are having the type 1 cartilage. And L for yes, remember ligament, they are having the type 1 cartilage. Remember aponeurosis is the part of the tendon, so tendon is also having the type 1 cartilage. Type 2 cartilage, it is found in the our type 2 collagen, sorry, not the cartilage. Type 1 collagen, type 2 collagen. Type 2 collagen is found in the our cartilages, and type 4 collagen, it is found in the basement membrane. If it is damaged, then lung basement membrane is damaged and our kidney basement membrane is damaged, so the patient will present with the hemoptysis, patient will present with the hematuria, which is known as yes, good posture syndrome. Very important question for your pathology and the medicine. So this is all. Okay, so final message for all the student, always I say life is better when you are laughing. So enjoy the session, enjoy your study, enjoy the tomorrow's exam, do something today that your future self will thank you for it. Okay, and yes, remember सब मोह माया है, जो हुआ अच्छा हुआ, जो हो रहा है वो अच्छा हो रहा है और जो होगा वो बहुत अच्छा होगा. Do your best, perform your best. All the best everybody.